I'm happy to have with us today Mr. Chris Inglefield, who is a plastic and cosmetic surgeon at London Bridge Plastic Surgery and is also one of our My Face, My Body specialists. Thank you very much for joining us today, Chris.
Hi Steve, it's a pleasure to be on the My Face, My Body show.
Well, we've got a really interesting topic, plastic surgery in the workplace. I mean, what have you seen with regards to the economic downturn that we've experienced? Have you seen a change with people visiting your clinic asking for certain procedures over others?
Certainly, Steve. We've seen over the last year an increase in anti-aging treatments and procedures, as well as feel-good procedures.
Is it more predominantly men or women, or?
Women still dominate the patients who come through the door, but we also see an increasing interest of men having the anti-aging treatments such as eyelid surgery or neck lift surgery.
What do you think's the cause of people having surgery? Is it the stress, or do you think, I mean, I'm not too sure really what it's all about. I mean,
well, I think it's an interesting question to look at, because I think there are a lot of factors about wanting to look as good as they feel, wanting to look younger and therefore be seen as competitive, but also just to boost their self-esteem.
I think, I mean, what we've seen is that from the more mature sort of people in the workplace, employees, is that they're having treatments, but even the younger generation seems to be having things like Botox and fillers to keep themselves looking good. Yeah,
absolutely. I think we've seen a big increase in the demand for non-surgical eye lift treatments in that younger age group.
I mean, it also is apparent that people in the UK seem to be a little bit more secretive about having treatments. Is this, I mean, I always compare it to the States. I mean, everyone seems to be singing praises and glory about their plastic surgery. I mean, what do you see with you?
I think the UK is catching up in that especially women are a lot more open about having things done because it's more acceptable, it's safer, there's less stigma about having a cosmetic procedure.
We had an email come through from Sarah Smelt, and she said she is 35 and she works in sales. She says that she gets really upset when she visits some of her clients because they always think she looks tired or she's had a hard night when she obviously hasn't. I mean, she says, you know, she has these fluid bags under her eyes and is not sure what to do about it. I mean, do you have any sort of advice for her?
Well, firstly, Sarah is in a very common place with a lot of mid-30s women and men having early eye bags. What she should make sure is that she is in good health, that the eye bags are not caused by any other medical condition, provided that everything else is fine. Then her options would be either a non-surgical treatment or surgery to correct her eye bags.
We've got another really interesting case study here. It's an amazing story from a lady we spoke to before the show, Linda, who is 45 and runs a performing arts school. After a history of illness that seriously affected both her looks and her self-confidence, Linda decided to go for a face and neck lift, brow lift, upper and eye lift, and a lower eyelid peel. So obviously quite a lot of procedures. Linda has not only regained her looks but also her self-esteem, which in turn has allowed her to move forward with her career. Her work involves meeting powerful movers and shakers within the theatre and performing arts fields, and this is where her confidence was flagging. Now, she has completely turned her life around and has recently been appointed to the Board of International Drama Encounters. She says that there is no doubt in my mind that I would have not had the confidence to have surgery if it wasn't for Mr. Lawrence Kerwin, a plastic surgeon in Harley Street. I mean, this is a perfect example of a fantastic story that really demonstrates how surgery has given back a patient's confidence and how she can really sort of move ahead with her life. I mean, obviously, I'm getting older as well, Chris. I mean, any suggestions for me before we leave you?
Just keep using that skin cream.
Great. Thank you very much for coming in today. Really appreciate it.
Pleasure.
Right, let's have a look at the My Face, My Body 2010 top 5 procedures that people are having in the workplace. Number 1 is teeth whitening. No surprises there. Number 2 is Botox and dermal fillers. Third on the list is eyelid surgery. Fourth is nose surgery. And fifth, my all-time favourite, breast surgery.